tell me about yourself.
So my name's Melissa Held, and I'm a licensed professional counselor. I've been doing individual counseling in my office for about 12 to 13 years now.
So do you come across eating disorders in your occupation, and how so?
I do. I see all kinds of eating disorders, such as anorexia, bulimia, binge eating disorder. And sometimes people come to my office, and sometimes they're referred by either inpatient or outpatient facilities for treatment.
So what's the hardest thing about working with these patients?
It can be very frustrating. A lot of them don't want to give up their eating disorder behaviors or don't see themselves as they really are.
Mm-hmm.
So that's really, really frustrating for them and for me as their counselor.
Right.
And relapse in general.
Right. So what do you think is the cause of eating disorders?
I don't think there's a simple answer for that. I think it's a combination of society in general, parenting styles, pressure in life, peers, the media. There's, I think, a lot of reasons.
Right. What's your opinion on the following statement? Eating disorders aren't that serious.
They are very serious. People die from them quite often, and they do cause other health problems even if it's not fatal.
Right. Do you believe a person's lifestyle has a direct impact on their health?
Absolutely. As far as the way we eat affects the way we feel,
Right.
or exercise, things like that can help us feel good about ourselves.
Can you talk about some warning signs of eating disorders?
Sure. The most obvious one, I think, for people with anorexia is losing weight very quickly, but also things like avoiding eating in front of people, like family members noticing that they'll only eat very healthy things, or they'll overeat and then go to the bathroom,
Mm-hmm.
things like that. And also, I think, isolating themselves.
Okay. How can you approach someone who has warning signs of an eating disorder?
That is a very difficult thing to do because many people are not receptive to it.
Right.
But just sort of doing it in a caring way and say, look, I'm really concerned about you. I've noticed blank, whether, you've noticed that somebody's going to the bathroom and vomiting, or somebody's lost a lot of weight, or shows that they're overly concerned about their body, something
Right.
like that.
What other factors are involved in eating disorders besides food and weight?
Body image is a big one. And also emotional.
Mhm.
People can be depressed or anxious or have, a lot of times I personally see people with OCD and eating disorders because the OCD becomes about the eating.
Right.
So those are some other common ways that they're linked.
Can you tell us more about pro-anorexia websites and how they're affecting people with eating disorders?
They're encouraging them to continue their behavior. They tend to go on them very often and use that as a reinforcer for their behavior, and thinking that it's okay.
Do you think cultural beliefs and the media have an effect on the development of eating disorders?
I definitely do.
How so?
Well, if we look back even in history, even in this country, in let's say the 1800s, people with curves and that were voluptuous were the thing to be, and people who were really skinny were the ones that were made fun of. So,
Right.
Society has changed, and therefore what people want to be like has changed.
Right.
And not everyone can be any kind of body style.
Right. How do you think eating disorders can be combated?
With a lot of treatment, whether that's like counseling, nutritional support, family counseling. There's a lot of different avenues.
Do you think there's enough awareness about eating disorders?
I think it's getting better, but no, I still don't think there's enough awareness.
So what else can we do to raise awareness?
Doing things like you're telling me about doing, and honestly, and having classes for young girls, and middle school, high school, maybe even younger.
Right.
Just talking about healthy body image and how your weight doesn't specifically matter.
Right.
Doesn't make you who you are.
Right.
Although people tend to think that, even adults.
Unfortunately. What advice would you give teenagers on body image and personal health?
I would encourage teens to love their bodies as they are and just try to be healthy and not try to be a certain size or weigh a certain number on the scale.
What advice would you give people with eating disorders?
That there is always help and not to give up.
And lastly, do you have any final thoughts on the matter in general?
Just that, eating disorders are a serious thing and there is help for it. And it's nothing to be ashamed about. I think a lot of people that have eating disorders are really deep down ashamed of their behavior
Right.
and are afraid to seek help and afraid to give up their behaviors.
Yeah. All right. Thank you
All
so
right.
much.
You're
I
welcome.
appreciate it.